Okay, so my name is Brianna Cohen, and this is my final project presentation. My presentation is called Telemedicine and Telehealth: History, Challenges, and the Future by myself, Brianna Cohen. For the history of telemedicine, early concepts starting with 1924, concept of remote healthcare first depicted in a magazine illustration. Imagine doctors diagnosing and treating patients via radio waves. 1960s innovations, NASA and academic institutions pioneer remote patient monitoring. Use telemedicine for astronaut health during space missions. Video consultations enable specialist access for rural hospitals. 1990s and beyond, internet expansion led to the widespread telemedicine adoption. Introduction of teleradiology and tel-ICU systems. Government funding boosted telehealth programs, particularly for veterans in underserved areas. And this is just an illustration of the two. For pre-2020 telemedicine landscape, provider to provider telemedicine, hub and spoke model, how remote specialists support local primary care providers, key specialties, for example, teleradiology, telestroke, telebehavioral health, barriers to adoption, regulatory issues, misaligned payment policies, provider resistance. Direct to consumer telehealth enabled via mobile apps, video calls, and digital health platforms. Used for urgent care, chronic disease management, mental health services. Adoption limited by technology costs, lack of broadband access in rural areas. The impact of COVID-19 on telemedicine, surge in telemedicine use. Virtual visits increased from 11% to over 60% during the pandemic. Hospitals rapidly integrated telehealth into routine patient care. Regulatory and reimbursement changes. Temporary waivers allow telehealth reimbursement parity with in-person visits. HIPAA rules were relaxed to enable broader telehealth access. Medicare and Medicaid expanded coverage for telehealth services. Infrastructure and training challenges. Healthcare providers needed quick training on telehealth platforms. Many facilities lack sufficient digital infrastructure for telemedicine expansion. For the future of telemedicine, it expanded scope and use cases. Growth in specialties, teledermatology, telecardiology, and teleoncology. Integration with wearable devices for continuous remote monitoring. Technological innovations, artificial intelligence, aka AI, for diagnostic and predictive analytics. Blockchain for securing patient data and electronic medical records. 5G technology improving telehealth video quality and real-time monitoring. Policy and accessibility considerations. Push for permanent reimbursement parity. Expansion of broadband access to rural and underserved communities. For the conclusion, telemedicine has transformed healthcare delivery, enhanced access to specialists, particularly for rural communities, improved chronic disease management through remote monitoring. COVID-19 accelerated telehealth adoption and regulatory changes. Temporary waivers showed the feasibility of widespread telemedicine. Expansion of reimbursement policies encourage long-term adoption. Future outlook is promising but requires investment. Continued development of AI, remote monitoring, and telespecialties. Policymakers must ensure equitable access and sustainability. And this is just my references for my works cited page. Then I also included challenges and barrier adoptions, regulatory hurdles, state medical license barriers, varied payer reimbursement policies, technology barriers, limited broadband access for rural population, high implementation costs for small practices, provider and patient adoption, resistance to telehealth workflows, concern over data privacy and cybersecurity. Governance and standardization in telehealth, need for centralized governance, standardized training and protocols for telehealth services, integration with existing healthcare systems, data security and compliance, HIPAA compliant telehealth platforms, blockchain and encryption for patient confidentiality, workforce training, encouraging provider adoption via education, telementoring, and remote supervision. Lessons learned from telehealth adoption, key takeaways from 1995 to 2020. Proven benefits, increase access, lower costs, improve outcomes. Sustainability requires investment, infrastructure, policies, incentives, trust drives, adoption, transparency, accountability, and provider-patient engagement. Post-pandemic telehealth strategies, building enterprise telehealth programs, aligning financial and operational incentives. Future innovation in AI and telemedicine, AI and machine learning, predictive analytics for early disease detection, chatbots and virtual assistants for triage patients, wearable and remote monitoring, smartwatches tracking vital and glucose levels, AI-powered alerts for patient deterioration, autonomous healthcare systems, AI-assisted robotic surgery, virtual reality and rehabilitation and therapy. For the conclusion, telehealth medicine transformed healthcare delivery, expanded access, improved chronic disease management. COVID-19 accelerated adoption, regulatory waivers proved feasibility and scalability, investment and policy changes needed, standardization, training, AI integration, broadband expansion. The future is digital, AI, wearables, and 5G will drive telehealth advancements. And this is just another works cited page of the additional sources that I had. Thank you for listening.